Welcome to class 3 of our National Certificate Lecture Series and Interdisciplinary Research Internship on Mental Health. Okay, so this initiative is organized by my foundation, Institute of Excellence in Research and Law, in collaboration with DHEE. So the title of the whole discussion of not only today but of the complete series is legal, constitutional, policy, administrative, geographical, socio-cultural, economic, political, institutional, technological, infrastructural, educational, gender-based, demographic, and human rights determinants of mental health accessibility in India. Okay, so good evening everyone. Today we are not just studying law. Okay, just a second. Yes, we are studying how society treats people who are suffering from inside. And before we talk about sections and rules, I would love to ask you people something very simple. If a person has fever, we take that person to hospital, right? Now, if a person has a broken leg, we help them to walk. But when a person has depression, anxiety, trauma, or hallucination, what do we do? Do we help them? Do we judge them or not? Ask yourself. For many years in India, mental illness was not treated like other illness. People were hidden in houses, sent away to institutions, tied, silenced, called mad, and they were treated without asking them. So obviously this was very painful, not just medically but also socially and legally. So hence India came up with a law in 2017 which we call as Mental Health Care Act 2017. Okay, so if you know, although if you don't know, okay, let me tell you this, that the earlier approach was control the patient. The new approach is respect the person. And this is the heart of today's lecture. Have you ever seen someone mocked for mental health issue? How did they make you feel? Just ask yourself. You can do one thing. You can simply write in your copy just 5 lines about what does dignity mean in simple words. You can write it. Please do not write it legally, write it from your heart. And I feel this is the most important thing that you must do here. Leave away all the academic things. I mostly prefer the discussion to be done in a way where your mind engages, where your heart is engaging, you're understanding the concepts. Okay? You're understanding the concepts. If you don't understand the concepts, and just for the certificate's sake you are here. Okay, you might get certificate if you pass the exam, but the problem is that you are missing the core discussion. Okay, every person goes through depression once in their life. Every person goes through the issue of anxiety. The thing is that how do you address that thing? That's a very fundamental question, and you have to address that thing. I hope you are understanding what I am trying to convey here. If you can give a thumbs up, thanks. Okay. Now, sorry. So what is law really trying to do here? So the law says mental health care is a right. Sorry. Every person has dignity. The treatment must respect the choice, and the government must provide services. Very simple idea, right? But the thing is that mental health is not a charity. It is not a kindness. It's a right. And please understand, these are very important for all the fields: law, psychology, sociology, anthropology, public policy, medical students, social people who are in social fields, researchers, everyone. Please try to ask one particular question. I'll be giving you 30 seconds. Sorry. Is mental health a personal problem or not? Or it is a social responsibility? So let me just reframe the question. Is mental health a personal problem only, or is it also a social responsibility? Ask yourself. You can write these questions. These are very important questions. They're very important questions. Now imagine there is no mental health law. Imagine, just imagine. You can write this in your copy. Now, if there is no mental health law, then write 5 possible problems that may happen. You just write it. You do not have to share with me. Just consider that there is no mental health law and see what may happen. 5 possible problems. See, these concepts which I am trying to convey here is the core of your research paper that you are going to write. Now, if you fail to understand these key concepts, your paper will become weak. So this is the reason I am going a bit slow. I am going very kind of point by point. Okay, I'm giving you that amount of time to process the information. Read as much as you can. Okay, understand the questions very carefully. Right. Okay. I hope you are understanding whatever I'm trying to convey here. Kind of thumbs up if you can, write in the chat box. If you can, please switch on your videos, I would say. Now comes the rights of the persons with the mental illness. So, this law gives many rights. Firstly, let us understand them simply. A person with mental illness has the right to get the treatment, has the right to be treated with respect, the right to live in community, right to not be abused, right to confidentiality, right to complain, and obviously right to legal help. Now, earlier, people were treated like objects. Now they are treated like citizens. And this is a big shift. Now, from a legal view, they are the rights holders. And from a medical view, you see, treatment becomes very ethical in nature. And from a social view, stigma reduces. And if you see this thing from a human view, they feel valued. But let us think honestly. Are these rights fully available everywhere in India or not? Maybe yes in cities, maybe difficult in villages. And this is where implementation matters, which I discussed in the last class. Okay? Now, 3 questions that I want to ask you people, and you can write it down. First, can a poor person easily access the mental health care or not? First. Secondly, are women free to seek therapy without permission? I again repeat my question, that can a poor person easily access mental health care? Question mark. Are women free to seek therapy without permission? Question mark. Do families always support treatment? Think about it. Write about it. What's your opinion? What has been your experience? Write on that particular matter. It should not have to be neutral. Just write from your own heart. Okay? Now comes what is capacity. See, when we say capacity, from a very legal point of view, it means that we are trying to ask a question, that can a person understand what is happening? Can they understand the treatment? So can they decide for themselves? Please note one thing. Mental illness does not automatically mean no capacity. Sometimes a person may understand everything very clearly, may make rational decisions, live independently, but sometimes during severe crisis they may be confused, not able to understand the reality, and are not able to think very clearly. Capacity can change. It is not permanent. It is very important to understand this thing. So earlier we used to think that if you are having mental illness, it means you lack that ability. Now, in today's everyday thing, we have to assess each person very carefully. The diagnosis must be done very carefully. That's the important thing, because this protects dignity. Here comes another question, that should society assume incapacity too quickly? First of all. Secondly, have we ever underestimated someone's ability or not? Please ask yourself these 2 questions. These are very important. Now I'm going to give you a kind of exercise which you can do in your home. Think of a time, okay, when you were very stressed or emotional. Did you make perfect decisions or not? Just ask yourself. Write 5 lines about how those emotions affected your judgment. So again, my question is that think of a time when you were very stressed or emotional. Did you make perfect decisions or not? And write 5 lines about how emotions affected your judgment. That's it. Clear, everybody? Can give a thumbs up so that I can understand that you are able to understand what I am trying to convey here. Okay. Now let us talk about consent. So when we talk about consent means that you understand and you agree freely and no one forces you. Okay. In the mental health care, consent becomes very complicated. Hmm. Now, what if a person refuses treatment? What if the person says, I am fine, but they are clearly suffering? Okay. Now, this creates a tension between autonomy and protection. And here, law tries to balance the both. It prefers something called supported decision making. It means we try to help the person to decide. We do not immediately replace their decision. So this is respectful. Please try to understand again the position when there is a kind of tension between the two things, which is very significant in nature, that is autonomy and protection. The law is trying to balance the both. So it prefers something called supported decision making. So it means that it is trying to help the person to take the decision. It is implying that okay, take the decision. We are not going to replace your decision immediately, which is very respectful in nature. So you can ask yourself: is freedom more important or safety or both? Okay. To understand this question in a very in-depth manner, if you are a psychologist, okay, I would ask you to write this particular question, or maybe anyone can say that should doctors ever override patient refusal? If yes, why? If no, why? You have to write for the both. Are you getting me? I hope these things a bit clear for you. So my question is that should doctors ever override the patient refusal? Okay. If yes, why you are saying this? If no, why you are saying this? Done? Now let us discuss something very powerful. Okay, so the law allows a person to write something called advance directive. So let me make this very simple. Imagine today you are mentally healthy. You are understanding everything very clearly. You wrote a document saying if I become very unwell in the future, I want this type of treatment, I do not want this medicine, I prefer this hospital, and I want this person involved in my care. This statement is known as advance directive. So it means even if law even if later you are confused or very sick, your earlier clear decision will be respected. And this is about dignity, this is all about respect, this is all about trust in the person. So from a legal point of view, it is protecting the autonomy. From the psychological point of view, it reduces the fear. From a social point of view, it gives power to the individuals, and from a medical view, it gives clarity to doctors. That's it. But now think very deeply. Even if situation becomes life-threatening, what if doctor think that the refused treatment is necessary? And this is where ethics and law meet. Okay? So you need to ask yourself here that should past decisions always control present emergencies or not? First question. Second question. Can a person predict their mental state correctly? Third is that what if family disagrees with the directive? These are the most important questions that you need to understand. Okay? Now, just a second. Now comes nominated representative. So, the law allows a person on appoint a nominated representative. Okay? So, in simple terms, or in simple words, if I say, you choose someone you trust. So, this person will support you, will help you to understand the treatment, will speak for you if you cannot speak, will protect your interest. So, this person can be a family member, a friend, someone you trust very deeply. Now, very important thing. This person, the person whom you are choosing, not automatically the family or not automatically the state. So, this respects the personal relationships. You are choosing, right? You are choosing that person. You are choosing that person. So here, the personal relationship is getting respected, even if he is not coming from the family. Now, let us think very carefully. Families are not always supportive. Sometimes they are loving, sometimes they are controlling. So hence, the law tries to balance the trust and the protection. So from an anthropological point of view, family structures are different in different cultures. And from a sociological point of view, the power relations exist inside the families. Okay? Vulnerable people may need protection even from relatives. You need to understand these things. So, here comes three important questions. That should family automatically make decisions or not? What if the nominated person misuses the power? And who monitors the representative? Three important questions that you must ask yourself. Right. I hope till this much it is very clear for you people. Okay. If you have any questions, I'll surely be asking you questions. I'll surely be taking your questions after this this lecture ends. Okay. Don't worry. Now, we are in guardianship and protection. Now, when you move to sensitive area like guardianship and protection, see, try to understand one thing. Sometimes a person may be so unwell that they cannot understand anything. They are at some serious risk. They may harm themselves. So, in such kind of cases, some form of guardianship or substitute decision may be required. But the law says it must be limited, temporary, reviewed regularly, not permanent unless absolutely necessary. So, earlier systems made people lose control permanently. Now, the idea is protect without destroying the autonomy. So, this is very delicate. So, too much of control is oppression. They are saying this thing like this, and too little of control is a kind of risky thing. So, here, what they are trying to say is that you need to balance the both. We cannot go into extremes in both the cases. Okay, write these three questions if you can. uh, when does protection become a control, and how do we prevent misuse of guardianship, and should there be time limits on guardianship or not? Okay, and another question that you can ask is that, right, okay, this is the question that you can easily you can use. What safeguards should exist before someone loses decision making power? 12 lines, just write it. I think that will be enough. Okay. Now, regulatory bodies. See, law alone is not enough. There must be a kind of monitoring. So the Act creates authorities like Central Mental Health Authority, State Mental Health Authorities, and then mental health review bodies. So in simple words, these bodies register mental hospitals, uh, check standards, hear complaints, review advance directives, protect patient rights. So think of them as like watchdogs. Okay. Now let us be very realistic. Are these bodies fully active everywhere? Hmm? Do rural districts have strong review boards or not? Are there are there enough trained officers or not? So this is where implementation becomes the real change. Real challenge. Okay. So the question here again coming is that, is passing a law is equal to solving a problem? Why do good laws sometimes fail? Is funding as important as legislation or not? Imagine you are a researcher and you are being given one topic, that are mental health review boards active in my state. This is the kind of uh, research topic that has been given to you. Think about this. Now you have to write one research question, one method, and one expected problem. Keep it very simple. What you're gonna do? Do it. Okay. So the question for you that I am gonna tell you up here, for example, you are a researcher, design a small study, take the topic as like, are mental health review boards active in your state or not? So one research question, one method, one expected problem. Do it. Check this out. Okay. I think these are the things. If you do, you will get a lot of clarity. Now, let us talk about this ground reality. See, even with a good law, there are some serious challenges. Shortage of psychiatrists, lack of awareness, social stigma, okay, poor infrastructure, then comes the urban rural gap, gender barriers, financial limitations. So mental health is not just a medical issue, it is also economic, social, cultural and political issue. So the, the problem here is that if a person cannot afford to travel to a hospital, is the right meaningful? If the woman is not allowed to leave home, is the access real? If a poor family fears stigma, will they seek help or not? So this is why all disciplines must work together. You must understand this thing. So the question here again comes is that does equality on paper mean equality in life? Should mental health care be part of the primary health care? And can the technology in specific if I say the telemedicine help the rural areas? Means if you are in rural area, if you do not have that kind of physical accessibility, okay, can the telemedicine be the game changer here? The big question. Okay. So let us ask ourselves a very difficult question is that can treatment be forced? Okay, let us understand this thing very carefully. Sometimes a person may refuse medicine, may refuse hospital. They might say I am fine, but the problem here is that they are not able to understand the realities. They are trying to harm themselves. In such situations, doctors face a very hard question. Should we respect the refusal or should we intervene to save the life? And here comes the conflict, the freedom and the protection. The law allows involuntary admission in limited situations, but it must follow strict rules. Clear medical assessment, documentation, review by the authority, not indefinite detention, regular review. Why? Because history shows that forced detention was misused. So the law tries to balance human rights and safety. Again, I am saying this. From a legal point of view, if you see this matter, procedure must be followed. From medical point of view, you see this thing. Risk must be assessed. From an ethical point of view, harm prevention matters. And from a sociological point of view, power can be abused. And from a human rights point of view, liberty is very precious in nature. And this is not an easy answer to make. You need to make your judgment carefully in this particular matter. So if a person is suicidal in nature, should the treatment be forced? If the forced treatment saves life, is it justified? If forced treatment causes trauma, is it harmful? Don't say anything right now. Think about it. Ask yourself, for example, let me pose you up a question. In extreme cases, involuntary treatment may be necessary. Agree or disagree? Write 50 lines. See, earlier in India, attempting suicide was treated as crime. Okay, think about that. A person is already suffering deeply, and the law punishes them. So now the thinking has changed. The approach is like suicide attempt means they are in mental distress. It needs care, not punishment. So this reflects a compassion. But the question remains, are the support systems strong enough or not? That's the fundamental question that you have to ask yourself when it comes to suicides. I'm in distress. What about the system? You are saying they are going to help me. Will they? Have you created that system? Have you created that environment? That's my core and fundamental question. Are crisis helplines accessible or not? Do police officers receive mental health training or not? See, law has changed. That's not the question. But did society fully changed or not? Should emotional crisis ever be criminalized? Do we treat mental pain seriously enough? Ask yourself. Imagine, just imagine, you are designing a suicide prevention program in a district. If you're doing that, write one awareness method, write one emergency support method, and write one long-term prevention strategy, and keep it very practical. Don't write it in a way it looks like it's something like kind of theoretical in nature, but it cannot be implemented practically. Write something which has, and you are backing up like how to do this, how to do that. It should be explained. Okay. Okay. Now comes a very important thing: confidentiality and family involvement. See, when I am talking about confidentiality, okay, your health information is very private in nature. That you need to understand. But in mental health, families play a very significant role. Okay. So the question here is that should family know everything? What if the patient does not want to share? Now here comes a tension again. The tension is between privacy and support. For example, a young adult wants therapy. They do not want parents informed, and parents are paying for the treatment. What should happen? See, different fields see things differently. Law is seen as like protecting the confidentiality. So psychology is seeing this matter like trust is very essential. From the sociological point of view, family dynamics matter. Anthropological point of view is that cultural norms differ. Policy is that when it comes to making the policies, clear guidelines are needed. Again, no easy answers, only balance. In this kind of matters, if you see, you don't get easy answers. Okay, so if you are a student who wants to clear UPSC or judiciary, these are very important things. You must be very clear of these things, that in this kind of complex matters, you will never ever get easy answers. Okay, you need to find a way. For example, if I ask you, is privacy more important than family support? At what age should confidentiality be absolute? Okay, so these are the very important questions you need to ask yourself. I will not be answering these things because these are such things that you need to answer for yourself. Now, is the law enough? Very important question. Now let us step back. Okay. See, mental health care is very progressive in nature. It talks about dignity, autonomy, rights, protection, accountability. But is law alone enough? For example, if there are no doctors, no hospitals, no awareness, no funding, no trained social workers, then rights remain on paper. Hmm. So the real change requires budget allocation, professional training, public education, community engagement, continuous research, political will. Law is the foundation, but society must build on it. So ask yourself, who is responsible for implementation? Is it only the government, or only the citizens, or also the professionals? Okay. Now, as we have come to the end of this chapter 3, so what we have learned, that mental health care is a right, capacity must be assessed very carefully, consent is very central in nature, advanced directive protects voice, nominated representative supports choice, guardianships must be limited, and then regulatory bodies ensure accountability, forced treatment must be very cautious, confidentiality must be balanced, implementation is the real change. Okay, and now I want you people to see something very bigger. Mental health law reflects the moral maturity of democracy. If a society protects its most vulnerable members, it shows the strength. Now, if it has the tendency to silence them, it shows fear. Okay? Close your eyes, just close your eyes. Okay? And ask yourself this question. Close your eyes. Please close your eyes. Okay, done. If you have closed your eyes, ask yourself, repeat with me. If tomorrow, repeat with me, close your eyes. If tomorrow I lose emotional stability, ask yourself these lines. If tomorrow I lose emotional stability, how would I want the society to treat me? Ask yourself these two lines. If tomorrow I lose emotional stability, how would I want the society to treat me? With control, or with dignity? Take 2 seconds of silence. See what your brain is saying to you. The answer will tell you what kind of law you want. Okay? And with this, we have ended this lecture.